Good afternoon. I'm Kevin Servac with the University of Maryland, Baltimore, Washington Medical Center, and welcome to Facebook Live. Today we're discussing something that many of us cringe when we hear about: kidney stones. I'm joined by Dr. Julio Davalos, who is the medical director of the Kidney Stone Program here at the University of Maryland, Baltimore, Washington Medical Center. We invite our Facebook viewers to submit a question by commenting below. Please let us know you're watching by liking this video, sharing it with your friends, and liking our Facebook page. Dr. Davalos, thank you for joining us today.
Thank you for having me.
So, kidney stones.
Yes.
Make a lot of people cringe. Nobody wants them. Can you let everybody know at home what they are and how do they form?
Sure. So kidney stones can form for a variety of different reasons, but in essence, it's almost a small miracle that we don't all make kidney stones. If you look at the chemistry of the urine, there's a lot of things that are in your urine, and they can kind of form deposits in your kidney like salts, which then turn to rocks, and that is in essence what a kidney stone is a crystal that grows in the kidney.
So, how common are kidney stones? Are they? Would you say they're more common in men, women? Do each get them equally?
So we see them in about 10% of the population. So 1 in 10 people will have a kidney stone in their lifetime. It seems to be on the rise. So there's more people are seeming to get kidney stones. We previously saw some differences between men and women, but currently we're seeing more of an equal distribution. So it doesn't seem like there's any real specific risk factors. Both men and women tend to get stones pretty equally.
Okay. So is it, who is most at risk for getting it? Is it people who have them, say like a family member has had them in the past? Is it hereditary?
So there definitely is a hereditary link. A big number of our patients do have either a mom, a dad, a brother with kidney stones, but you can also see it as sort of a new problem, and there are a variety of different risk factors for getting kidney stones.
Okay. Can you say, for instance, what those risk factors are?
So certainly things we'll likely touch on as we move through this. There's risks in terms of your diet, sedentary lifestyle. So we tend to be a relatively dehydrated society. If you look at babies or kids, they really drink quite a bit of fluids and waters naturally. As we get older, we tend to gravitate away from water. That can be a problem. Get chronically dehydrated. There are factors in our diet. Again, our modern diet that tends to lend itself towards stones. So those are some of the risk factors.
Okay. So what are signs that a person actually has a kidney stone inside of them?
So that's not too difficult to figure out because usually when you have a kidney stone, you're coming to us, either to myself or more likely to an emergency room, unfortunately, in quite a bit of pain. So that's the hallmark for kidney stones is pain, but that's also for a stone on the move. So stones can form in your kidneys and not actually cause any pain while they're forming. It's when they move out of the kidney into something called a ureter, which is a small structure that goes from your kidney to your bladder, causes blockage, and that's where the pain comes from. So you can actually have pretty big stones and not necessarily have a lot of symptoms.
So that's the pain. It's when you said it goes into the ureter?
Correct. Movement of the stone out of the kidney into that tube is what causes the pain. And as it travels through that tube is where you really see patients, some of them really suffering very badly.
So is it true that once you've had a kidney stone, you're more prone to get more in the future? And if this is true, why?
So yeah, once you have a kidney stone, there's a high likelihood, even a probability you would say that you'll make another stone. So that's really important. Anyone out there who's had a kidney stone or knows someone with a kidney stone in their history, if you come, we not only do the surgical interventions, which is obviously what hospitals are mainly known for, is that you can come here and get your stone treated or taken care of. But on top of that, we can also do what's called metabolic management, or just in layman's terms, a way to figure out the reasons you made the stone and then prevent a new one or reduce the risk.
Okay. So I know you mentioned earlier keeping yourself hydrated, so forth. Is there anything you can do to prevent kidney stones?
So beyond hydration, we do kind of have a list, so to speak, of about 3 or 4 recommendations that are generally good. However, I do want to emphasize that there is testing that we can do today where we have you collect urine, do blood tests, analyze a stone if we've happened to get one out of your body that we can analyze. And all that put together can actually come up with a treatment plan for you, a prevention plan that's specific to the reasons you made the kidney stones. But in general, we talk about hydration, we talk about a low salt diet, moderate protein, and most people have heard that calcium is linked to stones, so dairy products. But in that case, you don't want to actually cut dairy out altogether. So a normal calcium intake is what's recommended.
Okay, so diet does play a role in this as well.
Correct. So we certainly can't say that diet doesn't play a role. If you have a poor diet in terms of again the things we've touched on already, if you have some of the dehydration or the hot salty foods, you're going to contribute to stones. But interestingly, there's a good number of patients who, even if they have quote unquote the best diet, are still going to form stones, and that's why I encourage patients to go through testing, because there are sometimes things that are out of your control, beyond things that diet can manage, where we can step in and say, here's a supplement or a medication that can really help prevent stones in the future.
Okay. So beyond the pain, let's just say you're asymptomatic and you think you may have a stone. What tests are actually conducted to show you definitely have one?
Yeah, so if we suspect that you have a stone, the number one test that we're going to do, initially we may do an ultrasound of the kidney to do it as a screening test. Ultrasounds are in essence, they're painless. There's no radiation exposure. They can be done very quickly. So there's really little drawback to an ultrasound, particularly if you have any risk factors, either signs or symptoms, or you're just worried you might have one. If we suspect a stone on an ultrasound, the best test is going to be a CAT scan or a CT scan, and that's going to give us a lot of detail in terms of the size of the stone, the location, the density, how hard it is, how much stone you have overall, and that really will drive decisions moving forward in terms of treatment, if we even need it, if we do need to treat, what kind of treatment are we going to proceed with.
Okay, and that actually segues into my next question. So let's say you have the stone, it has to come out, and if you cannot pass that stone naturally, what options are there for actually removing it?
Sure. So when it comes to kidney stones, one of my taglines is size does matter, because the bigger the stone, the less likely it is to pass. So if we suspect you have a stone, if we find a stone in you for other reasons, say you had an infection or there's an issue with your kidney function, and then you get some testing that shows it, it's really going to be dependent on the size of the stone. So typically we use millimeters for measurements, which I know many Americans aren't familiar with millimeters, but 5 millimeters is about a 1/4 inch. So that's about where the size starts to be a problem. So between 5 and 10 millimeters, we can do treatments where we use an x-ray machine to find the stone and break it up without actually entering your body. That's called shockwave lithotripsy. We can also use internal scopes. Again, these are all done with you completely asleep, where we run a little camera into the body and sort of through the natural openings go into the area where the stone is, and then use a laser typically to break it up. And then the third option is if you're really dealing with bigger stones that are going to be more challenging to treat with either of those initial two options, is to move towards a small incision surgery. And these incisions are very tiny, the size of the tip of my pinky finger, maybe my index finger, so they're very small openings through the back into the kidney to directly remove the stone. And in that case, the stones are fairly large, so we're typically grinding up the stone, again, with a variety of different tools that we have before we actually remove the stone out of your body.
Are there any long-lasting health effects if you've had a kidney stone?
So if it's a smaller stone and you pass it, there's little risk to injury or damage to your kidney. But if we start talking about these bigger stones, again, stones that are 1/2 inch to 1 inch in size, which actually people can have very, very big stones grow in their body, those definitely carry some risk factors, and that's typically why we recommend treating those stones. Things like kidney injury, kidney damage, even kidney failure can set in. More concerning really would be because typically you have another kidney that can sort of pick up the slack, but stones have also been linked to infection. If infection gets sort of out of hand, it can actually form an abscess or a pocket of pus in your kidney, and that can even be a life-threatening kind of infection with something called sepsis, where bacteria can get into your bloodstream. So those are all the risk factors of sort of untreated larger stones. Repeated attacks with small stones can also lead to kidney injury, kidney damage, and have also been linked with infections. So those are some of the reasons that you don't necessarily want to not treat a stone if you have one, or particularly if you have a larger stone.
Excellent. So if you're just joining us, we're talking kidney stones today with Dr. Julio Davalos, who is the medical director of the Kidney Stone Program at the University of Maryland, Baltimore, Washington Medical Center. You may ask questions by leaving them in the comments section below. Also, please let us know you're watching by liking this video and our Facebook page. Now, let's take some questions from our audience.
Our first question is, could I have a kidney stone and not show any symptoms?
So it is very possible that you would have a kidney stone before you show any signs or symptoms. If you think about it, by the time you end up in an ER, let's say in pain, that stone has been growing in your body for probably months or maybe even a year or longer. So initially these smaller stones will grow inside your body sort of unrecognized, not doing anything too harmful to you. So certainly you can have stones and not have symptoms, but again, as they get bigger, if they start to move, then that's when you really will start to show some symptoms and or signs that your physicians may pick up depending on what kind of testing you're going through.
Okay, our second question is, are there preventative medications I can take to avoid kidney stones or keep them from coming back?
So yes, again, kind of going back to what I touched on earlier, we certainly know of certain things that we call stone inhibitors. So that's just a doctor way of saying things that help prevent stones from forming or the crystals from ever growing in your body. The most potent ones are citrate, vitamin B6, and magnesium. So there are supplements, particularly one supplement that actually combines those into one. But again, before, most of my patients, what I tell them is before you start chasing too many things to prevent your stones, the best thing to do is go through testing. Because if you have normal levels of citrate and magnesium and B6, then that may not be the answer for you. We may be looking at other options.
I heard too much dairy and calcium in your diet can cause kidney stones. Is this true?
So it is true if it's excessive. So if you have way too much calcium in your diet or dairy products, that can lead to the calcium spilling out into the urine, and most kidney stones are calcium based. What's interesting though is that when patients, probably back in the 80s and 90s, doctors were recommending kidney stone patients to stop calcium altogether. And what actually happened in those patients is they formed more stones. So there's definitely a sweet spot where you want to sort of have the right amount of calcium. So like most things in life, too much is bad and too little is bad. And again, remember, calcium is good for you in other ways. It helps with bone health and other processes in your body. So you don't want to cut dairy out altogether, you just don't want to overdo it. We recommend 1,000 milligrams a day, and again, that's maybe something that doesn't ring with you. You don't understand what we're really saying, but if you come in and talk to us, we can certainly help you out with understanding how to measure that, and we can even work with dietitians if necessary, to get that information to you.
Can children get kidney stones?
So unfortunately, yes. The youngest patient I ever treated was, in essence, a newborn with a 1 centimeter or a half-inch stone. We did wait until she was about 9 months old to remove the stone, and that was done with a very small incision into the kidney because there's no scopes that have been miniaturized that much at this point. And kids are much less likely to have kidney stones. I think one of the reasons is, again, as we get older, I think our diets and our risk factors change. Kids are very active, they tend to be well hydrated, and there may be other factors that prevent them from getting kidney stones. So it's about a 1 in 1,500 chance for a kid to have a stone, which is much lower than what we see in adults, but we do see it in kids. And then I think once you get to be 12 or 13, I definitely have seen more patients in that sort of early teen to late teens, and you kind of consider them almost young adults at that point, and there the incidence is going up and close to matching what we see in older patients.
Our last question is, how long should it take to pass a kidney stone naturally?
Well, anyone who's had a kidney stone hopes it's going to pass right away, and sometimes they can pass in a matter of hours. So we have patients who show up to the ER, and from the time they're sort of checked in to the time they've gone through testing, within a few hours, 5 hours, they pass their stone. That's unfortunately not the case for every patient, and stones can linger for days or weeks. And sometimes can sort of get stuck and never pass. So we don't recommend waiting too long, but if it's a small enough stone and we're not seeing any sort of real health threats, and as a patient you're feeling okay, I do have some patients who wait 2, 3, 4 weeks to pass a stone, and in some cases it can take up to that long or even longer to pass a stone. But most patients won't tolerate a stone that long, so I would say on the average within 2 weeks, if you haven't passed your stone, most patients are electing to have something done to remove it, because it's usually not a very pleasant week or two of trying to wait on that stone to pass.
Definitely sounds like it. So, Dr. Davalos, as we wrap up our conversation today, is there any last words of advice that you want our viewers to remember?
Sure. I mean, a couple of things I'll say. Here at the University of Maryland, Baltimore Washington Medical Center, we do offer, every option to treat your kidney stone, whether it's a small stone or a larger stone. We have state-of-the-art facilities and really an amazing team that has been put together here to take care of you. Beyond the surgical aspects, in prevention, again, I emphasize something called metabolic testing, which again is a doctor way of simply saying, let's figure out how and why you made that stone. Forget about all the 10 different reasons you can read about on the internet about stones, but let's figure out your specifics. And that's a couple of different tests that we can do. They're very simple, but they'll give us a lot of information, and then we can come up with a patient-specific prevention plan, which means a prevention plan that's for you, to help you, not come back. I tell all my patients, I'm glad we got you through this procedure. I'm glad that we got you stone free. Now I really don't want to ever see you in the OR again. Let's just meet in the office once a year and work on preventing those stones for you.
Excellent. Dr. Davalos, thank you for speaking with me today. And to our viewers at home, if you would like more information about the Kidney Stone program here at BWMC and treatment options, please visit our website at www.umbwmc.org/kidney stone. If you believe you have a kidney stone, please contact your healthcare provider as soon as possible. Thank you for watching Facebook Live.